It depends what kind of nose you have, obviously, but the first thing is, of course, that you want to look better. Whatever better is, that's of course very different from person to person. Some like a relatively straight nose, some want it a bit more scooped out, other people like to maintain part of the hump that they might have, some like a slimmer nose, some wider, some want bigger noses, which means you need to put something into the nose, for example cartilage or something else. Most of the people want smaller noses that are called reduction rhinoplasties. That's probably the majority of Caucasian noses. They are made smaller, not bigger. But of course it entirely depends upon what your personal preference is. There's no real right and wrong. There are other people who love their nose the way it is and they just leave it. No, it's actually not. So surprisingly enough, let's say you break your nose in an accident, in a fight, doing sport, it is usually very painful, as some of us have probably experienced. Rhinoplasty is not really painful. It's probably more, for most people, more painful to have a bit of a sore throat from the tube that the anesthetist needs to put in to make somebody breathe while you're asleep. The pain after rhinoplasty is actually pretty minimal, most often. There might be exceptions, but most often that is the case. This is dependent on the surgeon. I allow most of my patients to go home the same day, provided they are not alone for 24 hours, provided they do not travel more than an hour away from the hospital. I like to have them a bit closer by. And also, of course, they're not allowed to drive a car for 24 hours because of the general anesthetic, which might make you feel very good, but you might still be a bit slow, maybe like a drunk person, so it's not a good idea to drive in the first 24 hours. But in general, they can, nearly all of them can go home the same day in my practice. There are some people who handle that differently, but I must say I never had anybody in the last 10 years who needed to come urgently back with a rhinoplasty to have something done. So that's probably why I'm a bit more laid back about this. Scarring in rhinoplasty. There are different kinds of rhinoplasty. Those that are done from inside of the nostril, which are called closed procedures, and those that are done with a little cut just here in between the nostrils, which would then involve opening the skin, such as you would open a banana. And of course the one where you cut the skin just in between the nostrils will obviously leave a scar there. There's no cut to the skin from a surgeon which doesn't leave a scar. There are pros and cons with these different procedures, obviously. No surgeon would try to make an unnecessary scar. In a closed rhinoplasty procedure, in most cases, what I'm saying here are just average, it's average information. There can be still some people who need much more before the healing is over, and some people are a bit quicker. But let's say in a closed procedure, this area here usually heals pretty quick. Probably, I mean, visible swelling is probably away after 6 months. Until everything is completely healed in this area, it probably takes a year. With the tip of the nose, it can take far longer to shrink down. Some even slightly thicker skin can sometimes take 18 months to go back to the stage where probably not much happens anymore. But let's say the swelling to go out in most people is away after 2-3 weeks. So most people take 2 weeks of work and then go to work in an open and closed procedure. It does not mean that this is the end result. This really takes sometimes 18 months, or with a tip actually most often. But to be ready to go back to work, unless you're a model and the looks are incredibly important, then after 2 weeks most people go back to work. Obviously when you shave a hump off and you take the splint off, the hump is gone. So this part will probably be visible more or less straight away. Tip work, you might be able to see it straight away, but in some people it's exactly the opposite, that it swells so much that the tip looks bigger than before straight away, and then slowly over time the tip shrinks down. So some effects you see straight away, some you don't do at all. When the splint, which means the cast, comes off, some noses look far too small because the cast pressed the nose together, so some people think, oh my god, my nose is too small now. And in some people it's the opposite, it's completely swollen, looks like a little cherry, people think my nose is bigger than before. So directly after the splint has come off, you cannot see that much. I mean, you can see that the hump is gone, but I think that's probably pretty much anything where I can really be more or less sure. The rest you see slowly over time. Okay, recovery times. In a closed rhinoplasty procedure, most surgeons would use dissolvable sutures. That means they fall out, you don't do anything. The splint, in most surgeons would keep the splint for 1 week. I keep them for 2 weeks. I keep the splint for 2 weeks because I actually think that if you splint it slightly longer, the chances of having a straighter nose are slightly higher because the bones are already firmer when you take the cast off. So I think it's safer to take the cast off after 2 weeks.